So, good morning. The City of Lovington is making its best effort to keep our community informed on the latest and most factual information possible concerning COVID-19, or as it's commonly referred to as the coronavirus. We've invited several of our partners from our community development organizations, as well as our local media, to help participate in this first Facebook Live press conference, as we're calling it. We're going to be following up with this with a written press release in English and Spanish so we can get good information out to as wide of an audience as possible. Today's release, it does contain two parts. I'd first like to address the public health order that was signed by the Secretary of Health this morning. As you know, there is COVID-19 present in the state of New Mexico, but there is none reported in Lee County. There are only 28 cases, but once again, there's no cases reported in Lovington or anywhere in Lee County. Due to the presence of the virus, the New Mexico Department of Health has issued this public health order, and it emphasizes and requires the use and implementation of social distancing to help reduce the spread of the virus and any other type of disease that we have. Per this new order that took effect, all mass gatherings are prohibited. We're actually practicing this today. We only have 10 people in this room, and they're spread wide apart. But this is now a requirement and ordered by the Secretary of Health. In addition, all restaurants, bars, breweries, eateries, other food service establishments, they're limited to takeout and delivery only. Any indoor shopping, such as malls, your recreational facilities and health clubs, athletic facilities, and theaters, are also closed for the duration of this order, which right now it runs till April 10th. Any casinos and horse racing facilities and attendant bar and restaurant operations located on non-tribal lands are also required to close. Any businesses that are not engaged in providing essential services should limit operations to the greatest extent possible and minimize employee contact. In addition, any hotels and motels are not permitted to operate at more than 50% capacity. This doesn't apply to facilities that are supplying lodging to healthcare workers or providing temporary lodging to those who are employed in New Mexico. In addition, all public and private employers are required to comply with the order, and every state agency will be ensuring compliance with the order. Also, we would like to point out that per a message from the governor's staff, the limitations do not include grocery stores, shelters, courthouses, banks, correction and detention facilities, hospital and healthcare facilities, or places of worship. In addition, the public health order is requiring that grocery stores and other retailers limit the sale of over-the-counter medications, durable medical equipment, baby formula, diapers, sanitary care products, and hygiene products to 3 packaged items per individual. This does not apply to prescription medications. So, in addition to that, the order goes on to remind the public that they need to stay home and only go out if it's absolutely necessary, and that's the core component of social distancing. This will help you avoid contact with any sick person. In addition, we have to practice standard hygiene frequently. Wash your hands with soap and water for at least 20 seconds. Do this often. Hand sanitizer products, it's merely a replacement when you don't have the opportunity to wash your hands, but you do need to wash your hands as often as possible in order to limit the spread of any type of illness. Avoid touching your face, your eyes, your nose. Avoid contact with high-touch surfaces. That includes handles and buttons. And also avoid shaking of hands as well as any physical contact during this time of social distancing. When you do have those types of contact, wash your hands immediately or use hand sanitizer until you can wash your hands. We take this order very seriously, and we have taken steps to make sure that the City of Lovington complies with the directives and recommendations. The second part is I just want to assure our public that we've had plans in place for a situation like this for well over a decade. Now, granted, prior to this, we have not had to implement it. It's all been done in practice, but we are prepared, and we've executed those documents. These documents that we use are our plan. It is a fluid document. It's adaptable to the situation. Our pandemic operations plan, as well as our current status of Lovington and Lee County, we've all executed our plan. The first step, of course, as it has escalated, we have identified our key members of our incident management team. Some of the members of our team are here today, although they are in a separate room watching this. But we do have Mayor David Trujillo and Mayor Pro Tem Bernard Butcher. They are part of our incident management team as well. In our operations section, we have Terrence Lizardo, our fire chief. Our finance chief is our finance director, Gary Chapman. Our logistics section is Wyatt Duncan, who works in public works. We also have our administrative section to deal with any human resource issues is Shannon Lester, our city clerk. Our liaison officer is Police Chief David Rodriguez. We do have a planning section chief who's responsible for identifying areas of the plan that need to be improved upon and also providing education to our staff, and that's Skylar Farnham, and our public information officer, David Miranda. All of these folks have been an essential part of our response efforts at the local level, but also none of this would be possible without our strong partnerships with our local entities. Norley Hospital being one. We're relying on them heavily for us to be provided accurate and timely information. In addition to that, we have our partners at Lee County, the Lovington Municipal Schools, and our other municipalities throughout the county. Over the past several weeks, we've all been meeting, we've all been planning to make sure that we are prepared to handle this event. And as we have stressed earlier, there are no cases in Lee County yet. However, in the event it does occur, we are prepared. In terms of moving forward, we have taken a couple of steps that if you haven't watched or read any of our press releases, I just would kind of like to briefly go over those. One is we have enhanced our communication with our partners. We've been meeting with all of them via teleconference repeatedly over the past couple of weeks since this event has started. We've also increased our communication and transparency with the public. We have enabled a special tab on the city's website, Lovington.org. It's called COVID-19. And at this site, we actually have verified links to our partners such as Norley Hospital, New Mexico Department of Health, as well as the CDC, to where you can get factual and up-to-date information. And please use that as a resource for you to get factual information. The last thing we want is false information being spread and causing panic. In addition, we have instituted, as of this morning, the limitation on no more than 10 people in a room in all of our city facilities. We have instructed our staff and emphasized the importance of good sanitation and hygiene practices and providing sanitizing stations at all of our facilities that are still interacting with the public. We have suspended the use and reservation of our athletic fields until May 1st. In regards to complying with the 10-person maximum per room, this does pose a problem. Even though we have canceled all of our board meetings with the exception of city commission meetings, we still have to comply with our Open Meetings Act. So in order to overcome this hurdle and allow for the public to see that we want to be as transparent as possible, we will still continue to live stream our meetings where that link is located at our website at Lovington.org, but we are enabling the ability for the public who desire to make public comment to dial in via teleconference and participate in that portion of our meeting. The public should call 312-757-3121. The access code for that meeting on Monday night at 5:30 will be 709-420-165. Now, this is a conference call service, so the number will change, but we will make sure that that up-to-date information anytime that the city commission meeting or the city commissioners convene in a public meeting, we will have that information posted on our website as well as on the agendas that are produced. We just want to make sure that everybody is aware we truly embrace transparency and we really value input from the public, and we're doing everything we can to comply with the Open Meetings Act as well as comply with the public health order and respect social distancing. We also have, as of this morning, limited access to our library. We have shut down the Main Street entrance. You can enter that library through the Left Street entrance, but it is limited to a maximum of 10 people within that facility at one time. The convenience center, we've had several calls on that. At this time, it is open to still accept waste. However, we did have to postpone our free dump day we had scheduled for this weekend. Also, one thing we want to stress, and I'm sure that the mayor and mayor pro tem can emphasize this as well, businesses are not shutting down. They're just having to modify operations. They may be working with reduced staff, but this is necessary to respect social distancing and comply with the order from the Department of Health. We are strongly encouraging shop local, shop often, call in, have them deliver it to your house if it's food, but make sure that you do have the supplies necessary to get through this. But we need to support our local businesses, also our neighbors, help out our neighbors. So once again, I can't thank our partners enough. We are prepared to take further steps as necessary, and we will make sure that we keep our public informed as to any changes in our response. Also, once again, we have been prepared. We remain dedicated to our mission of serving the public. We want to try to keep operations as normal as possible, but please be patient if we do have to reduce some services in other areas. Of course, this wouldn't work without the support of our mayor and our commissioners, our partnership with North Lee Hospital, Lee County, and the Lovington Public Schools. These make our county great, and believe it or not, it's taken a crisis, but this moment in history proves that that statement is right, that our partnership is what makes Lovington go, as well as Lee County. We will have a couple of questions from those who are attending, but before that, I'd like to introduce David Shaw, our CEO of Northern Hospital, and he'd like to make a couple of statements.
Thank you, Mr. Williams, and I'd like to repeat what he said. The partnership that we have with the city, the county, and other entities throughout the county has been extremely important to addressing this issue. I want the community to know that as of this moment, there are no confirmed cases in Lee County, and I think that's important for everybody to know. And I also want you to know that the over 500 employees at North Lee Hospital District are fully engaged and are working hard to protect the community. And we're continuing to provide a full array of services at the hospital district. A couple things I think they're important for you to know. We do have a pandemic plan. It's an emergency plan. We drill on that plan annually. We've had that plan in place for a number of years. And so our hospital district is very well prepared for a situation such as this. I know there's a lot of people who are concerned that they may have the virus. I just want to repeat again, please do not panic. There are symptoms, shortness of breath, fever, cough, sometimes muscle cramps. If you have those symptoms, it's important that you call the hotline that we've established. And that number is 575-396-9090. We have healthcare professionals that are on the phone that will answer your questions. If they feel like you need to be tested, you'll be directed to a drive-up site, which is located at Home Medical, which is across the street from the main campus. It's really important that you call. Do not go to the emergency room. Do not go to the walk-in clinic. We're trying to protect the public, and if you come into those locations, you could expose others, and we're trying to protect vulnerable populations. You can be tested at the drive-up site. I also want to remind everybody the vast majority of people that do contract COVID-19 are going to have mild symptoms. So keep that in mind as well. The testing, unfortunately, it takes 48 to 72 hours to get results back from the state lab. So we ask for your patience. If we think you may be at risk, we may ask you to go home and self-quarantine. I can assure you that our doctors will call you back immediately with the test results. The hospital district has implemented some operational changes to protect the public and to protect our staff. These changes are creating some inconveniences, and I just ask for the community's patience during this time. Some of the changes, we have closed the south entrance near dietary. We have closed dietary to the public. We had to close the Lovington Wellness Center last night. We have limited entrances to the hospital. You can come in through the Lovington Medical Clinic, you can come in through the emergency room, or you can come in through outpatient center. You will be thermal scanned. We will be taking your temperature. If you have a temperature, we'll be giving you a mask, and we will get you in contact with a doctor. Again, this is to protect staff as well as to protect the vulnerable populations in our hospital. So these inconveniences will be in place for the time being, and again, they're here to protect the staff. I also want to mention our website, www.nor-lea.org. We have a number of informational items on that website. We have links to the CDC, to the Department of Health. I have posted videos there. Our doctors will be posting videos in the coming days. I would encourage you to go to those websites to get accurate information about COVID-19 and what the hospital district is doing. I do want to caution the public. Right now, we're providing a full array of services. As this pandemic continues, it may require us to eliminate some services temporarily to consolidate staff in areas where they're needed the most. But we will keep the public informed throughout that time. Again, your hospital district is here to serve you. They're doing a fantastic job. They're very committed to this, and they understand that they're on the front lines, but they also understand this is something that's important for our community. And I'll turn it back over to you, James. Thank you.
Sure.
David, sorry, I have a couple of questions from the public, if that's okay, really quick before you step off. I have somebody asking if you are still seeing patients for a cold or if you want them to call for a cold.
Yes, we're still seeing patients in the walk-in clinic if they have a cold. If they do not have the symptoms that I described, they can come into the walk-in clinic or make an appointment with their provider.
And can you please repeat the phone number again in case you have any questions about it?
So it's 575-396-9090. Thank you.
Are there any other questions? Because that's all we're, Mr. Grant?
Now, James, what do you see the biggest challenge for the city during this time of dealing with coronavirus? What do you see the biggest challenges as far as dealing with the public?
So right now, it's just making sure that we are able to perform our function while respecting social distancing. That's the big thing. Mm-hmm. We already have contingency plans in place to look at what we call critical staffing, where we would reduce staff that would have to interact with the public to where it's just alternating schedules. So making sure that we have a healthy workforce as well. We are making sure that we have emergency services, our police and fire, making sure that they stay healthy as well, and have contingency plans in the event somebody does at one of those services get sick, to where we're not dealing with an infection spreading amongst that group. The other thing, of course, that I know is probably on everyone's minds is revenue-wise. Not only are we dealing with social distancing and the effect on that, but of course everybody's very well aware of what's going on with oil, and that directly impacts us. So we are instituting different things in regards to our revenue contingency plan. We have a hiring freeze in place right now because we do have to have revenues in order to operate and provide those services. But we just want to make sure that when the public calls us that we are there, and that is our #1 priority. And so it's just figuring out those pieces there.
Do you see any reductions in trash services, water services, any of that at this time?
Not at this time. The water will still flow. It'll still be treated. It's still a great source. So your taps will continue to flow. As far as trash service, we have been working with Waste Management, and right now the only potential interruption in service is their call center. It is actually being, running on reduced staffing, and they're working on getting telepresence set up to where they can still interact with those customers, but we don't anticipate any interruption in those services.
I had a question from one of our business owners last night about their specific business. And I know right now all the businesses are open, but they have to take guidelines. What if they have specific questions, if they're what their procedure are, they're worried about fines and stuff like that? Who should they call specifically? I got the information for them, but who should they call specifically based on their unique situation?
So if it's a license or permit question, they should contact that issuing agency. that would be our first recommendation. And then, of course, if they do have questions, they can go through the Lovington Cares website. It's lovingtoncares.org, and submit their question through the contact form, and we will make sure that that message gets referred to either the appropriate city department or get them in contact with the appropriate state department for those specific questions.
And this question is for David Shaw. If, because I think, and I don't know how everyone feels, but me, I feel like I have this just low level of stress just hovering over my head during all this. Like, I feel fine. My family is in good health. They're both essential, so they're out working on their jobs and stuff like that. Who can they call if they just feel like they need more information? Again, can you give us more numbers or your website where they can feel like I need to learn more about social distancing or something?
Sure. Again, they can call that hotline, 396-9090, or they can call the hospital specifically. We have behavioral health specialists, counselors they're on duty right now that can assist them. And you're not incorrect. I'm the hospital administrator, and I feel that stress. And my wife and I had a conversation this morning about, well, we're not going to be able to travel as much as we used to, so let's come up with a plan. And so we talked about, this year let's focus on our garden. Let's focus on this room that we wanted to remodel. So I think it's helpful to have those conversations and think about, plan, what are some things that we can do together as a family, as partners to occupy our time and do something productive. And so I think those are helpful things. Get out. The wellness center is closed, but the streets are still open. You can get out and walk around the neighborhood, keep that social distance, and get your exercise. Stress management exercise is very important. Eating right is very important. Don't eat a lot of junk food right now. That's just going to stress you out and lower your immunity. Eat healthy, get some rest. Those things are very important during times like these.
James, I had one additional question. Can you help clarify if hair salons are also included under the beauty spas?
Reading that order, which we're going to, it will more than likely be posted on the NMDOH website under their latest updates. Usually those are finalized around 3 or 4 p.m., but as soon as we get a signed copy of the public health order, we're going to post it on our city's website. As far as the hair salons, I don't believe that's what that was intended. However, businesses need to look at, both government and private business need to look at, is this an essential service? Do we need to have our full staff there just to respect that social distancing? So from a regulation standpoint, if they had any questions, they would contact their licensing agency. But right now, my interpretation of that is no, but is it truly what they consider an essential service? Most people believe in getting their hair and their nails done, but we do need to respect that, because the only way that, in the event that this does hit Lovington or Lee County, the only way that we're going to limit an increased number of cases is through social distancing. It's working throughout other areas, and that's the only way that we can continue to keep our community healthy. Anything else? Well, I do appreciate y'all's time. I know this is a little bit different. We plan on doing more, so please provide us any feedback. We're always here 24/7. Send us messages through Facebook, through our website as well. But thank you all very much.